Understanding the viral hepatitis is actually really easy if you have the right framework. And the test can throw at you some pretty tough questions that become more straightforward if you can keep this stuff straight. As we go through this lecture, what I want you to pay attention to is the route of exposure, whether or not the virus can cause acute or chronic inflammation, knowing that if it can cause chronic inflammation, it can lead to cancer, and then whether or not it has a vaccine. At the very end, we'll go into hepatitis B and C specifically to cover some of the stuff you have to know. We're going to compare each of the hepatitis viruses on a chart. We're going to talk about their route, whether it's acute or chronic. And if it's chronic, it means it can cause cancer. We're talking about hepatocellular carcinoma. Whether or not it's DNA or RNA type virus, whether there is a vaccine, and how you handle serology. We're going to do that for each of the hepatitis viruses. Hep A, B, C, D, and a little bit about Hep E. Hep A is hep acute. It is an acute virus only and never causes chronic inflammation, so never can cause cancer. The route is fecal-oral. Not washing your hands, contaminated water, or some ingenious sex acts. It's an RNA virus, and it does have a vaccine. Serologies are easy because it is only acute. If you see acute serology, IgM, that means you are currently infected. This is what you test for if you're wondering if the person's LFT elevation is from hepatitis A. If you have IgG, it means you are immune because it's only acute, and if you have been exposed to hepatitis A, you're likely then to be immune, unless you're immunocompromised for some reason. So if you have IgG, immune, IgM, actively infected. Now, hepatitis A can only cause an acute inflammation, and the viral hepatitis can cause serious elevations in the LFTs. So if you see AST and ALT in the thousands, and you get a hepatitis panel, the IgM for hepatitis A is elevated, that's what's doing it. Hepatitis B is hepatitis both. It can be both acute and chronic. And because it is chronic, it means it can cause cancer. Hepatitis B is transmitted through sex and drugs, sex and blood. And blood means blood transfusions and intravenous drug use. But hepatitis B is the one that's transmitted sexually. None of these other viruses do that. Hepatitis B can be transmitted vertically from mother to child as well. It is a DNA virus, and there is a vaccine. But because it can be both acute and chronic, there's two presentations. The person with an intact immune system, that is the adult who has sex with a sex worker who has hepatitis B and contracts hepatitis B that way, will be able to clear the virus. And so it will not be chronic. But in that clearance process, the body destroys the liver, trying to get at the hepatitis virus. So if you are to clear hepatitis B, chances are what will happen is you will have a fulminant hepatitis like being infected with Hep A. The AST and the ALTs will be in the thousands. A person will be jaundiced, fever, right upper quadrant abdominal pain. If they survive that fulminant hepatitis, they'll have cleared the virus. On the other hand, if they're immunocompromised, HIV/AIDS, or that vertical transmission to a new neonate, they won't have any symptoms at all, but they'll be infected. They won't clear the virus, they won't have a fulminant hepatitis, but then they have a chronic carrier state. And if you're a chronic carrier, you can end up with cancer. The serology for hepatitis B is pretty complicated. Hold that in your left hand. We'll come back to it. Hepatitis C, if you've been following along, hepatitis A was acute, hepatitis B was both. Hepatitis C is the chronic hepatitis. And because it's a chronic hepatitis, it can cause cancer. It generally does not present as acute. Hepatitis C is transmitted through blood transfusions, and now the big risk factor is intravenous drug abuse. It was thought to be contracted through sex, but now we know that's not true. You have to be bloody, blood-to-blood contact, either through a needle, through a transfusion, or through pretty rough sex in order to get hepatitis C. You should not associate its contraction of hepatitis C with sexual encounters. You should associate it with blood transfusions and drug abuse. It is an RNA virus, and there is no vaccine. The serology for hepatitis C is complicated. We'll talk about that in a minute. Hepatitis D is a virus, and it is chronic, so it can lead to cancer. But it only exists as a superinfection. You must have hepatitis B first in the chronic carrier state in order to get Hep D. It is a DNA virus and has no vaccine. Serology is not relevant. And hepatitis E. Hepatitis E, what you're going to see, is a third world patient who's pregnant and has hepatitis. We don't see it a lot in America. So if you have a test question about a third world pregnant woman and it's about hepatitis, it's Hep E. Okay, so I want you to see how easy this becomes. Hepatitis A is acute, hepatitis B is both, hepatitis C is chronic. Acute means fulminant hepatitis, and chronic means cancer, hepatocellular carcinoma. And chronic, of course, can lead to cirrhosis. Let's talk a little bit about hepatitis B and hepatitis C. Talk about hepatitis C first, because the serology is easy. There's going to be 3 states, and it's dependent on the RNA status, the viral load, and the antibodies. If the antibody is positive and the virus is positive, you are currently infected. This is that chronic carrier state that most people who get infected will be like. If the antibody is negative, but the RNA is positive, this is an acute state. That is, the person just got the virus in them, but has not had time to mount an antibody response. If, on the other hand, the antibody is positive, but the virus is negative, this is somebody who has been treated. Now, I lied earlier when I said that Hep C is always chronic. Some people can get infected with Hep C and clear the virus. In that case, their antibody would be positive and the RNA negative. That person wasn't treated and can have this exposure pattern. But where I want you to associate positive antibody, negative virus is a person who has been treated. And up till recently, treatment was with ribavirin and interferon. Ribavirin and interferon make you feel like crap. You have the flu for a year while you're getting treated, and you had to track viral loads and check logs and see if there's a log decrease at certain times. That's no longer the standard therapy, especially for the genotypes that we have in our country. You may still see a question about flu-like symptoms or not being started on these things for psychiatric disease like depression. Where you should go now is the protease inhibitors, also referred to as the direct-acting antagonists, and look for medications that sound like boceprevir. Hepatitis B is the one that's a little bit more complicated, and you have to kind of memorize all this stuff, and there's no real good way to go about this other than to memorize. Some vocabulary. S stands for surface, E stands for infectivity, and C stands for core. We're talking about serology, we're talking about antibodies. If you have the surface antigen, you are infected. There is virus currently in your blood. If you have the antigen of infectivity, you are infectious. If you have the antibody, IgM, to the surface antigen, you are in an early infection. You know that it's early because of IgM. If you have an antibody, IgG, to the surface antigen, you are immune. But you don't know how you got that immunity. Both being exposed and clearing the virus, as well as the vaccine, will give you the surface antigen antibody. But having that pattern means you are immune. If you have the antibody to the core antigen, you gather that immunity through exposure. The only way you get the core antigen antibody is by being exposed. So you do have to memorize this to know what they mean, because you might get asked. And unfortunately, there is no treatment for hepatitis B because it's not prevalent enough in our country. But some facts you should know about hepatitis B is that you can end up with hepatocellular carcinoma even without going through the process of cirrhosis. And you can reduce this risk by treating with antivirals. This is getting pretty deep into the hepatitis topic, and so I don't think you really should spend this much time on it. Memorize instead the immune patterns and what they mean, and then be able to separate acute, chronic, and cancer. That's viral hepatitis.